Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the lower right 6, and the lower right 6 basically has endodontically treated tooth. We've got the mesial root, which has two cavities. The mesiobuccal seems till the apex, whereas the mesiolingual is slightly under obturated, as well as we can see void. We've got approximately a 4.5 millimeters of under obturation, along with a periapical radiolucency, which can be seen right here. Moving, and then you can see that there's a cavity which is involving or is very close to the furcation area and the lingual aspect of the furcation. So there is a cavity or carious lesion which is in beneath the core buildup or this filling material, and it is actually leaking from the lingual aspect, as you can see right here. This is also very close to the furcation area. Moving to the lower right 6 distal root. The distal root, however, seems to be appropriately obturated, but we have a major periapical radiolucency, which can be seen right there. Now, the next tooth in question is the upper left 6. The upper left 6 has a carious lesion on the mesial aspect. Here you can see the carious lesion has actually encroached into the pulpal region right there, and very clearly you can see that the pulp horns are involved in this carious lesion. Now, moving apically, we can appreciate that we've got very sclerotic teeth, but we've got an MB1, we've got a faint MB2, we've got an MB1, we've got a distobuccal, and we've got a palatal. So all 4 canals are present. However, MB2 is very sclerotic, so access to this nerve is going to be very challenging. Moving to the transaxial view, which is basically the proximal view, you can see that the MB1 is very clear, the MB2 is very faint. We've got the palatal, which is also very clear, and then we've got the distobuccal. The palatal, the most interesting aspect of the palatal is this is not where the apex is. The apex is actually curving towards the interradicular area right here. So this is going to be a challenge. The working length of this tooth approximately is going to be 17 millimeters. Moving to the distobuccal canal seems normal, and the working length of the distobuccal is going to be somewhere around 15 to 16 millimeters. The working length of the mesiobuccal canal is going to be approximately 15 millimeters as well. So these are the working lengths. We've also showed you the canal configuration. If there are further questions, please feel free to reach to our team. Thank you very much.